The Tibiofemoral Joint Clinical Case Study by Matt Carson, Tony Kraus, Michael Nelson, and John Schober.
For our case, we have Elaine, a 55-year-old woman who was enjoying a pleasant day on the ski slopes at Winter Park. When she got on the lift, the weather was fine, windy but sunny. During her ride, the weather changed suddenly and it became a whiteout with icy surface and snow. Very strong winds and very low visibility. Many people fell off as they got off the lift, including Elaine. However, she got up and joined her family members. As they stood, she fell again, and this time twisted her knee and an external rotation. At the time, there was no pain. She thought she'd get up and prepare to get down the mountain, but her knee was too unstable. While she sat on the icy surface, ski patrol arrived to put her on a sled, and which brought her down the slope. Then she went to the emergency room, and she had pain that was localized on the medial surface of her right knee, which had begun to swell.
First, I think it is important that we look at the tibiofemoral joint as a whole. The tibiofemoral joint can also be referred to as the knee, and it is a synovial hinge joint. This means that there is a joint capsule between the three bones that make up the joint. The bones involved are the femur, the tibia, and the patella. There is also a lot of ligaments in the knee. It has a medial and lateral collateral ligament, an anterior and posterior cruciate ligament, and a patella tendon. A majority of the muscles from the upper leg insert at the tibiofemoral joint, while a majority of the muscles from the lower leg originate at the tibiofemoral joint. The knee also contains bursa sacs, which reduce friction where ligaments, muscles, bones, and/or tendons rub together. Because the knee is a hinge joint, it is only able to flex and extend the leg. Based on how little movement the joint can produce, there's a lot of stability. However, this means that when the knee is moved in an unnatural way, it can cause a lot of instability, which is exactly what is shown in Elaine's case.
When it comes to ligaments of the knee, the medial and lateral collateral ligaments prevent lateral or medial rotation when the knee is extended. The medial collateral ligament is connected at the medial epicondyle of the femur and the medial condyle of the tibial shaft.
When it comes to common knee injuries, the knee is the most susceptible joint, especially when it's related to sports. Being very stable when it comes to vertical blows, there's a trade-off causing the knee to be vulnerable to horizontal blows. Common knee injuries occur to the collateral ligaments, crucial ligaments, and the cartilages, or otherwise known as the menisci.
Another common knee injury is knee bursitis. This is when a bursa sac becomes inflamed. Inflammation of the bursa sacs most commonly occurs over the kneecap or on the medial side of the knee. Knee bursitis causes pain and limits your mobility. Also, the infected area will become swollen, warm, and tender. Treatment for knee bursitis often includes a combination of self-care and doctor-administered treatments to alleviate pain and inflammation.
Another common knee injury happens with the meniscus, which is a piece of cartilage that provides a cushion between your femur and your tibia. A meniscus tear is caused by twisting or rotating of the knee. You are especially susceptible when putting all your weight on it. Tearing your meniscus causes pain and swelling in the knee, as well as the inability to move the knee properly. Ligament tears are the most common injury of the knee. Anterior cruciate ligament tears occur when sudden stops or changes in direction happen, as well as jumping and landing. ACL tears most commonly occur in sports like soccer, basketball, football, and downhill skiing. Some symptoms of ACL tears are severe pain and swelling and the feeling of instability. A medial collateral ligament tear happens when the knee twists either laterally or medially from pressure that can come from contact or no contact. The MCL can also tear distally. The MCL will typically tear from more sudden and fast movements, most common in sports like hockey, football, and skiing. An MCL tear is most common in cases like Elaine's.
When looking at Elaine's symptoms, we believe that she has a tear in her MCL. Symptoms for an MCL tear include pain and tenderness along the inner part of her knee, which can increase hours after the injury occurs. The feeling is if your knee has no stability, and swelling. These symptoms were all shown in Elaine's case. Another reason that we chose this diagnosis was because when Elaine fell, she had twisted and bent her knee externally, which could have easily snapped the ligament.
Another diagnosis that Elaine could be knee bursitis. Elaine has pain and swelling in the knee, which are similar symptoms to that of bursitis. We don't believe that this is knee bursitis, though, because of the instability in Elaine's knee. Another diagnosis could be a meniscus tear. A meniscus tear has the same general symptoms as an MCL tear, but we ruled this out because a meniscus tear wouldn't have swelling localized on the medial side. We also had to rule out an ACL tear because Elaine's pain and swelling was delayed, whereas an ACL tear would have immediate pain and swelling.
The best and most efficient way for the recovery and rehabilitation of the MCL is reducing or eliminating pain and swelling, restoring range of motion and strength back to the knee. Ligaments are made up of connective tissue with great regenerative properties. The ligament will be able to heal itself even without surgical help, depending on how bad the injury is. If the injury is more severe, surgery will be needed. The recovery of an MCL tear can take as long as 12 months to heal and for the pain to subside. The best way to go about this is to make sure there is the mobilization of the knee so it reduces the laxity and increase the strength of the ligament when it is reformed. In regards to Elaine's recovery, since she is a middle-aged woman, her recovery will take longer and she will become more susceptible to re-injury. Her joints and bones have decreased in strength and flexibility as she ages, which puts her at a higher risk for similar injuries and a slower recovery. Joint problems ranging from mild stiffness to debilitating arthritis are very common. The risk of injury increases because gait changes, instability, and loss of balance may lead to falls, like the one that occurred when she fell on the ski slope.
There are a lot of ways that you can prevent a ligament tear in your knee. The best ways to prevent an MCL tear include doing balancing and strengthening exercises. Exercises must challenge your balance, which will activate stabilizers muscles around the knee. This will strengthen the surrounding muscles, which in turn improves the stability of the knee. It is important that these exercises are done with proper technique, though, so that you don't risk further injury. You can also wear a knee brace to make the knee feel more stable, but wearing a knee brace shouldn't be solely relied on in order to keep the knee stable. After recovering from her injury, Elaine is able to live a happy and healthy life. She is able to easily do any tasks that her life demands, while she is also able to take care of her favorite son, Tony.